Many common medications, some available over the counter, others prescribed routinely, have the potential to elevate liver enzymes, often silently. These elevations are not always dangerous, but they can be a sign that the liver is under stress. For people with pre-existing liver conditions, fatty liver disease, or already elevated enzyme levels, this added burden can push the liver toward more serious damage. The risk doesn't lie solely in the medication itself, but in the dose, duration, and individual sensitivity, making careful use and medical monitoring absolutely essential. Acetaminophen, paracetamol, is perhaps the most well-known example. It's widely used for pain and fever and considered safe at standard doses. But the margin between a therapeutic and a toxic dose is narrower than most people realize. Just slightly exceeding the recommended amount, especially over multiple days, can lead to liver enzyme elevation and, in extreme cases, acute liver failure. This risk is significantly heightened in people who drink alcohol, have liver disease, or are undernourished. It's a leading cause of liver-related emergency room visits, often in people who had no idea they were in danger. Statins, used to lower cholesterol, are also commonly associated with mild increases in liver enzymes, particularly ALT and AST. In most cases, these elevations are temporary and don't indicate true liver injury. However, in a subset of people, especially those with pre-existing liver disease, heavy alcohol use, or polypharmacy, statins can contribute to hepatic stress. The risk isn't high, but it is real, and it justifies regular liver function tests in patients taking these drugs long-term. Antibiotics are another frequent culprit, particularly those metabolized through the liver, such as amoxicillin clavulanate, erythromycin, or isoniazid, used for tuberculosis. These drugs can trigger liver enzyme elevation through various mechanisms: direct toxicity, allergic reactions, or disruption of bile flow. Sometimes the damage is subtle, but in rare cases, antibiotics have caused severe hepatitis or cholestatic liver injury that required hospitalization. Patients often assume antibiotics are benign, but their liver impact can be delayed and unpredictable, particularly with repeat exposure. Antifungal medications like ketoconazole, anti-seizure drugs such as valproic acid, and certain antidepressants and immunosuppressants also pose a risk, especially when used long-term or in combination with other liver-metabolized agents. Herbal supplements marketed as natural alternatives, such as kava or green tea extract, can also elevate enzymes or cause overt liver injury, further complicating the picture. One of the most overlooked risks is polypharmacy, the use of multiple medications at once. Even when individual drugs are relatively safe, their combined effects can overwhelm the liver's metabolic capacity. Drug interactions can alter liver enzyme activity, increase blood concentrations of certain compounds, and cause unpredictable inflammatory responses. For older adults or those with chronic conditions, this becomes a major risk factor for insidious liver damage. It's important to understand that liver enzyme elevation does not always mean permanent damage. In many cases, it's a warning signal, an early marker of stress. If caught early, the damage is usually reversible by stopping the medication or adjusting the dose. That's why monitoring is critical. People on long-term medications, especially those with known hepatic effects, should have their liver function checked regularly. Skipping these tests increases the chance of catching problems only after significant damage has occurred. In conclusion, many widely used medications, including painkillers, statins, and antibiotics, can raise liver enzymes and compromise liver health, especially when misused or taken long-term without supervision. While these drugs are often necessary and beneficial, they must be handled with respect, not casual routine. The liver is resilient, but not invincible. Medications that pass through it should always be accompanied by vigilance, moderation, and regular medical oversight.